Plan for learn of cranial nerves. 1. Name of cranial nerve, English, Latin. 2. Types of fascicles. 3. Nuclei, name, position of nuclei. 4. Exiting place from brainstem. 5. Exiting place from the skull. 6. Branches and their supply regions. Now we will consider the scheme of the trigeminal nerve. Trigeminal nerve, fifth pair of cranial nerves. It is mixed nerve. It consists of motor and sensory nerves. Fascicles. Trigeminal nerve has 4 nuclei, motor nucleus and 3 sensory nuclei, mesencephalic nucleus, pontoneal nucleus, spinal nucleus. The nuclei lie in pons and projects to superior triangle of rhomboid fossa. The trigeminal nerve exits from pons through trigeminofacial line between pons and middle cerebellar peduncles and directs to trigeminal sensory ganglion. Rule for sensory cranial nerves. Each sensory cranial nerves except first and second pairs have peripheral sensory ganglion, which is the gray matter and presents by bodies of first neurons of sensory conductive pathways of cranial nerves. The trigeminal ganglion presents by bodies of first neurons of sensory dendrites of trigeminal nerves. The trigeminal ganglion lies on trigeminal impression of apex anterior surface of temporal pyramid. Trigeminal nerves subdivides into 3 branches. First branch, ophthalmic nerve. Second branch, maxillary nerve, and third branch, mandibular nerve. Ophthalmic nerve is sensory nerve, exits from cranial cavity through superior orbital fissure into orbital cavity and subdivides into 3 branches: frontal nerve, lacrimal nerve, and nasociliar nerve. Frontal nerve directs superior orbital wall long. It subdivides into supraorbital nerve and supratrochlear nerves at the level of supraorbital border of frontal bone. Supra orbital nerve exits through superior orbital opening of frontal bone and supplies the skin of frontal region, superior eyelid and superior conjunctiva of eyeball. Supratrochlear nerve supplies the skin of medial orbital angle, glabella and nasal root. Lacrimal nerve directs lateral orbital wall along and supplies the lacrimal gland and skin of lateral orbital angle. Nasociliar nerve directs medial orbital wall along and subdivides into 4 branches: anterior ethmoid nerve, posterior ethmoid nerve, short ciliary nerves, long ciliary nerves. Anterior and posterior ethmoid nerves exits from orbital cavity into nasal cavity and supplies the mucosa of anterior half part of nasal cavity. Short ciliary nerves supplies the parasympathetic ciliary ganglion of third pair of cranial nerve, oculomotor nerve. Long ciliary nerves supplies the fibrous vascular sheets of eyeball. Maxillary nerve is sensory nerve, exits through round foramen of sphenoid bone and directs into pterygopalatine fossa. Inside these fossa it subdivides into 6 branches: zygomatic nerve, infraorbital nerve, sphenopalatine nerve, posterior alveolar nerve, greater palatine nerve, ganglion are branches. Zygomatic nerve supplies the skin of zygomatic region, lateral angle of orbital rema. Infraorbital nerve exits through inferior orbital fissure into orbital cavity, lies to infraorbital groove, then into infraorbital canal and exits through infraorbital opening to canine fossa of the maxilla. Infraorbital nerve supplies the skin of infraorbital region, inferior eyelid and inferior conjunctiva of eyeball. Infraorbital nerve inside infraorbital canal gives anterior superior alveolar nerves, which through same name canals inside body of maxilla, which supply superior incisives in canine's teeth. 2. Sphenopalatine nerve goes through sphenoherpetine opening on medial wall of pterygopalatine fossa into nasal cavity and supplies the mucosa of posterior half part of nasal cavity and nasal sept. Posterior alveolar nerve goes inside superior alveolar canals of maxillary bodies and supplies superior premolars and molars teeth. Greater palatine nerve downs from pterygopalatine fossa through greater palatine canal into oral cavity and innervates the mucosa of hard and soft palatine through incisive canal, incisives teeth. Ganglionic branches I supplies the pterygopalatine parasympathetic ganglion of facial nerve. Mandibular nerve is mixed nerve. It consists of motor and sensory fascicles. It exits from skull into through oval opening of sphenoid bone. Under spinous opening it gives meningeal branch which goes out into cranial cavity and the innervates the dura mater of middle cranial fossa. The branches of mandibular nerve subdivides. Muscular branches to masticatory muscles, auricular temporal nerve, buccal nerve, lingual nerve, inferior alveolar nerve. Muscular branches have corresponding innervating muscles named temporal nerve, masseter nerve, medial pterygoid nerve, lateral pterygoid nerve, tensor tympanic nerve, tensor soft palate muscle, mylohyoid muscle. Auricular temporal nerve supplies the parotid gland, skin of anterior auricular region and temporomandibular joint. Buccal nerve supplies the buccal skin and mucosa of cheek. Lingual nerve supplies the mucosa of anterior 1/3 of the tongue and regulates pain and temperature sensations. Inferior alveolar nerve directs into mandibular canal and exits through mental opening. And continuous to mental nerve. It supplies the mandible and inferior teeth. Mental nerve innervates the mucosa of oral vestibule and skin of inferior lip. Temporal nerve supplies the temporal muscle, masseteric muscle supply the masseter muscle, medial and lateral pterygoid nerves supplies the medial and lateral pterygoid muscles. These muscles regulate movements of temporomandibular joints.